everyone, my name is Kristen and welcome. I'm currently in my second semester of nursing school and I do talk all things nursing school. So today I did want to discuss what I take to lab with me and all my supplies. So if you're curious on what a nursing student does during lab, just go ahead and keep watching. Alright, so I do just want to quickly cover the basic items that I feel like are very important for you to have for lab, and that is just because I feel like these are items that you won't be given by your school. My school actually gives us the care kits as we are learning the skills. Some schools will give you a whole bag at the beginning of the semester. It just depends on how your nursing school is. But let's quickly get into the first few items so then I can go ahead and start talking about the other lab supplies that I have. The first item that I have is a clipboard. Now I did just get this clipboard from Target. I've had this for a few years. I did just upgrade to a foldable clipboard for clinicals. So I would suggest if you can throw $30 towards a clipboard, get the foldable one first. But if you already do have a clipboard, you may not need to buy one right away for nursing school. I didn't until I got into clinicals, but this one is just a portfolio that I did get from Target a while back. And if you open it up, it is really nice because it does have a folder for you to keep things organized, and then a memo pad, which if you happen to run out of space, you can actually rebuy these at Target as well. So I would suggest, like I said, if you can get the foldable one, get that one first, but you don't need to spend any money on a new clipboard if you already have one. Now you may or may not have a space to write during lab. I know for my lab, we did not have anywhere that we could write on. So some students utilized clipboards, some other students utilized their textbooks to write on, which I feel like that's just very heavy and to carry around. And then other students utilized their iPads, tablets. But we all know me, I do like to handwrite my notes, and you most likely will need one of these for clinicals. So if you're able to invest in the foldable one so you don't have to buy two separate ones, I would suggest that. I just already had this one for a few years, which is why I utilized it for lab. You will just realize that when you're in clinicals, carrying something like this around is pretty impractical, and you can't just leave it anywhere because of HIPAA, and you don't want to violate HIPAA as well. So it's just really nice and easy to have that foldable clipboard. It actually fits right in my scrub pocket and has been so useful for clinicals. These next few items I'm just going to quickly go over just because I feel like they are very intuitive, but sometimes you may not think of them. Just to bring some extra hair ties and a hairbrush. You are going to have to put your hair up at all times. At least this is how my lab is, and I have heard others' labs like this as well. They want to get you prepared for clinicals, and you are going to have to wear your hair up. So just make sure that you come prepared with extra hair ties because mine seem to break very easily. I would also just quickly suggest to bring a stapler, binder clips, paper clips, book rings, your choice, just to make sure that you keep all your paperwork together. I know for my class, we constantly have to turn in loose leaf paper, and you want to make sure that it's bound together, because if your professor happens to lose it, you want to make sure you get full credit. So something you may not think about are dry erase markers. Now, when I was in lab, we actually did utilize the dry erase board often to take notes. I was constantly taking pictures of the notes that were on the dry erase board as well. And when I'm in clinical, I've actually been utilizing these a lot. A lot of the times when you go to the hospital, you have a board that the nurse will write on to kind of talk about what time they're coming back, what they're gonna do a little bit later. So it's just a nice way to keep communication between you and your patient in case they do forget. Well, being in the hospital is very overwhelming. You're gonna forget things, and most patients don't really know what the medical terminology is. So you just wanna make sure that you keep them informed. And I think this is a great way to let them know, hey, your next hourly round is in an hour. I'm gonna write that down and I'll be back to see you. So I would suggest to just keep these with you. Regardless if you use them for lab or not, you will use them in clinical. Another thing you may not think about right away is a 4-function calculator. Now, your school may or may not allow you to use a scientific. Mine doesn't. So I did just go to the dollar store, and I think Walmart has them for very cheap as well. And I just picked 2 of these up because you never know when one's gonna break and when you're gonna need it during an exam. But every class that I've had so far, I've had some sort of math, like pharmacology, I've been having a lot of math problems. So it's just good to make sure you get a cheap little 4-function to always have one on hand. And I know I can't say this enough, but now that I'm constantly washing my hands in the hospital and always wearing a face mask, my lips are drying out, my hands are starting to dry out, bring some sort of lip moisturizer and lotion with you. I can't even tell you how important it is to make sure you get a fragrance free. You want to make sure that you're not putting a lot of scents on you, because when you're next to a patient, they could actually be allergic to the scent that you're wearing. So you just want to make sure that you tone it down with the scents. Now, the next few items that I have, now we're getting into the fun stuff, and that is my blood pressure cuff and my stethoscope and everything inside my stethoscope case. So let me go ahead and open up my manual blood pressure cuff. Now, in nursing school, you do have to learn how to take vitals manually. Now, I can tell you, when I got to clinicals, we were told we didn't even need to bring our blood pressure cuffs with us. However, nurses still do have to take manual blood pressures if there are no automatic blood pressure machines available. So yeah, this is what it looks like. It just has the cuff, the gauge, and the little pump. Now, this is a little bit different from the previous one that I showed in one of my first videos, and I just like this one a lot better. It does have this little metal bar that makes it so much easier to just put it on a patient. I feel like when you're trying to pull apart the blood pressure cuff and like squeezing it around a patient, it's just kind of difficult sometimes, and I just don't want to nick somebody's skin if they maybe have some more skin like in the back part of their arm. So I did want to get this one, even though we don't use it at clinicals. And now I'm just moving on to everything that is inside my stethoscope case. So this is what it looks like. I will go through all the items, but I just want to show you that I have my stethoscope on one side, and all the other items in this pocket right here is just a mesh pocket. Now, I do have a Littmann Classic 3. It is the all black with the rainbow bell and diaphragm. I really just wanted to keep it simple, but I felt like the black was just a little bit too simple for me, so that's why I got the rainbow at the bottom. Mine's not engraved. I actually did order from Etsy one of those little tags that has my name on it, just in case somebody decides to walk off with this, because these are not cheap. And my clinical instructor has already asked to use my stethoscope, and I'm just like, when I give it over to somebody, I make sure I get it right back because I bought this with my own money. And I also think getting a stethoscope is a great way to personalize your style. I did talk about in my What's in My Backpack for Nursing School video how badge reels are also a nice way to personalize your style, just because you are wearing a uniform constantly, and it's just a fun little way to show off your favorite things or your favorite colors. So definitely make sure you put your own personal spin on these items. Now, I do just want to say, it's also very important to make sure you get a stethoscope that you can actually hear out of. Now, I know there are other brands that are just as good as Littmann. I personally feel like this Littmann has been amazing so far with me learning sounds. I've really been able to distinguish between normal and abnormal, and I just feel like this stethoscope is going to prepare me a lot better as well. And I also kind of do have a very random item in here, which I think is essential, but that's just me, and that's an essential oil. This one just happens to be lemon. It is just a Walmart version. I just picked one up that was very cheap because I'm probably gonna honestly go through this very quickly. I do know that lavender is the stress relieving essential oil, but I would suggest to bring some sort of scent with you whenever you go to the hospital. Now that I've been in the clinical setting, and I mean, even just working at a hospital previously, there are some very funky smells. When I mean funky, I mean funky. And when I walked into clinical a few days ago, I was like, So sometimes I feel like the essential oils come in handy. I will literally just take a very small dot and put it right underneath my nose. And now that we're wearing masks, you can't really tell that I'm wearing an essential oil. And I don't put on that much either. It's just a very small dot so I can smell the lemon. I'm very picky on my essential oils as well. I would suggest, if you can tolerate lavender, to get like more of a floral scent, but I'm actually one of those that are sensitive to smells, so once I find a smell that's good for me, I try not to shy away from that smell. And I really do love the smell of lemons, so that's why I have this one. But I really do think this is such a great item that nobody really talks about, and I can't believe I just discovered this, because I may have to update my 10 essential items video, because now I'm feeling like the essential oil is just as important. All right, and now I'm just gonna go through these items right here. I do have a watch with a second hand. Now, some schools will let you have an Apple Watch, some will not. Now, my school at the beginning kept saying no Apple Watches, and now my clinical instructors are like, sure, just don't be on it like texting. So I feel like if you can get away with an Apple Watch, that would be fine, but my school at the beginning, we did have to get a watch with a second hand. And I would suggest, if you do have to get a watch, make sure it's one that you can wipe down very easily, just because you want to make sure that you're keeping your watch clean. Now that we are in measures where we constantly have to make sure that everything's being wiped down and sterile, This watch is just a Casio watch. It is a specific nursing watch that has the military time on here. This one's just like a plasticky material, so you can literally just wipe it down very quickly. I do have 2 pen lights in here. Now, I did just get black to keep with the black theme that I have, and they do have the pupil sizes on the side, and I really do feel like if you're able to find one that has natural lighting, I would suggest that, because these ones are pretty bright. I'm not sure if you're gonna be able to see how bright they are, but sometimes the patients are like, ooh. So I would try to find one with natural lighting, but sometimes the LED ones are all that we can find. I do also just have my bandage scissors in here, which I didn't really use these in lab at all, I'm not gonna lie. But now that I'm in clinical, I can see how useful these are. I know nurses are constantly cutting like gauze, tape, things like that. So I do keep these with me when I'm in clinical. I also keep alcohol pads in here. You wanna make sure that you're constantly wiping down things, especially like your stethoscope, before you use it on a patient, just because you want to make sure that you're keeping things clean. Another thing that I can't stress enough is to have all kinds of black pens. In my lab, we are only allowed to write in black pen. They would allow us to write in pencil whenever we were doing math problems, but they really did want us writing in pen whenever we can. And now that I'm in the hospital, I can see that we do write only in black pen. All right, y'all, now I'm getting into the fun lab supplies. So let's go ahead and dive into what all this stuff is. All right, now breaking it down, I'm gonna talk about kind of how I received these items in order and what skills I went through first. So one of the very first things we did as students was learn about PPE, which is personal protective equipment. So I was given gloves, a mask, as well as a gown, and you bet we had to wear them, take them off, put them on. We went through all different scenarios of what contact precautions were, airborne precautions, isolation precautions. So we were tested pretty heavily in our lab, where we actually had to go through a patient scenario, and then we would have to put on the material that we thought we had to wear in the room. That was fun. But essentially, we all know what a mask looks like on, because we all have to wear them right now, and we all know what gloves are too. But the gown, if you've never seen a gown before, they do come in like this material, which I don't even know what the material is, honestly. It doesn't even say, just made in China. So this is kind of like a meshy material, where sometimes you might see almost like a shiny material. It kind of reminds me of a trash bag, honestly. They also use those as well. I've seen multiple in the past few years in hospitals. It just depends on what the hospital gets. But the ones that I've seen, you actually put them on in the front, and you will just put them on like this. And then there's actually a place where you can tie this behind your neck, and you'll just tie this here, and there's a tie right here that you can actually tie behind your back. So you definitely want to make sure you're gowned up whenever you're dealing with a patient that has contact precaution as well as airborne precautions. So we really just gown up whenever we're dealing with patients that are on contact precautions, and normally this just means whenever we are like touching them or we're getting in contact with their bodily fluids. So a great example of this are C. diff patients. C. diff is normally one of the #1 hospital-acquired infections that you'll see in the hospital, and by gowning up, we can keep ourselves and everybody else protected. The next few items that I received in lab, which I have a bunch of for some reason, are sterile gloves and a sterile field. So I did have to learn step by step how to pull out a sterile field. It's essentially just a drape or a towel. Now, sterile fields are very important. Literally only the 1-inch outer edge is the only part that you can touch in a sterile field unless you are also sterile. So it kind of gets complicated, but a lot of the times you'll use a sterile field when doing like bedside procedures and things like that. And I know it can get very complicated, so I kind of just want to keep it very basic, but you will learn a little bit more about this in nursing school. Now, to go along with the sterile field, I had to learn how to put on sterile gloves. Yes, there is a step-by-step way on how to put on sterile gloves. Now, sterile gloves, are pretty much like surgical gloves. They are going to be thick, and they are sterile as well, so they're not going to have any bacteria or anything on them that could cause infection. So these are very utilized in the hospital, but you also want to make sure that when you're asking your patients what allergies they have, make sure you ask them if they're allergic to latex, because a lot of the times these sterile gloves are made with latex. And believe it or not, there are actually foods that can indicate if they could develop a latex allergy. foods like bananas or other foods that have specific proteins that are very similar to latex could actually produce a latex allergy. So you want to kind of assess more so other items that they could be allergic to that could cause a latex allergy. Now, the next competency that I had in lab was on medication, vital signs, and injections. All those materials for the vital signs I already showed you, and the materials for like the medication and the IV, they just provided all those materials for us, so I don't have anything to show you on that. So I am just going to move on to the next item, which is the item I was supposed to get tested on, but then we moved online, so I actually never got tested on it, but that is a dressing change tray. Now, this is also known as wet to dry dressings. I actually do have 2 of these because I did go to one of the after-hour labs that they have. They're just like an open lab where instructors will help you kind of go through the skills if you need some help. So I got an extra one in that lab, and I have an opened one right here. And these are pretty cool. Like when you open them up inside, you really get to see what the nurses use at the hospital. So once again, you'll have a sterile field. This is one of those skills that you have to learn and maintain your sterile field skills. So all the materials that are in here essentially will help you change a dressing. So a lot of the times when you're changing a dressing, you want to see how much fluid or blood or drainage is on the dressing before you change it. There is like a little tool that can help you measure how big the wound is. And they have a little trash bag that comes in here that you can put all the bio waste in. Then they have sterile scissors in case you need them because you need to cut some gauze when you're changing the dressing. Then they have gauze, and then they also put saline in here. Now, I have learned that some kits will or will not come with saline. And the last few items that they have in here are just a kind of pad or what you would consider like a bandage that would go over the wound. And they also have a label in here. Now, I've been talking about this. You do have to label right on the actual dressing change itself. So if you have a Sharpie, you can actually bypass this label so it doesn't fall off, and you can just go ahead and write on the gauze tape or whatever. The next kit that I have in here is a Trach Care Kit. I was actually supposed to get a second kit that goes along with this, so I don't have all the correct items. In case you don't know, a trach is just a device that kind of goes in the trachea so the patient can breathe a little bit easier. And the items in here are mainly just to keep the trach clean. So I do once again have like that sterile field. I have a bunch of like cotton swabs and just a few other items that can go around the trach to kind of just make sure that we keep that airway patent. And what I mean by that is we just want to make sure that we keep that area clear of any mucus or any drainage. So this is just what it looks like. There's not really much in this one. This next skill was probably one of my most favorite skills that I got to learn other than when giving injections like sub-Q or IM. And that is the IV bag that I have right here with the tubing. Now, I did get to learn how to spike the bag as well as prime the tubing. And essentially when you're giving an IV, it's very important that whatever medication you're giving or just normal saline, that the tubing has no air bubbles in it. So you do have to sit there and wait for the tubing to fill up with the medication or liquid. And that's what priming the tubing means. But there's a lot of different things that go along with IVs, and I hope you enjoy it as much as I do when you get to learn about it. The last item that I have to show you today is a Catheter Care Kit. Now, this one just came in a bag, so I did just pull it out. So this one did come wrapped, so I am just unwrapping it. Once again, this one does come with a sterile field and sterile gloves. Now, you do know that when you are working in the peri area, you do have to be sterile so you don't cause a urinary tract infection, because CAUTIs, or otherwise known as catheter-acquired urinary tract infections, are probably one of the most prevalent that you'll actually see in the hospital. So you'll see that doctors don't even really prescribe Foley catheters unless they absolutely need to catheterize the patient. Most of the times they will just straight cath the patient, and all that is just a one-time catheterization, so you don't leave the catheter sitting inside the patient. And this just comes with some antiseptics as well as a a little cup to collect the urine. Once again, documentation that goes on the outside of the sample, and just the device that you would insert And I don't know if I actually have everything in here either, because I think when we were discussing it in lab, we were missing a few items. But that is all that I have in this care kit. So those are all the items that I would take to lab with me or utilize while I was in lab. Hopefully you enjoyed this video, because I feel like I didn't know that we would go through all these items when I was in nursing school. So hopefully this gives you some perspective on what you will be learning, and hopefully gets you excited for nursing school as well. Please don't forget to like this video if you enjoyed watching, and don't forget to subscribe. And always leave your recommendations down below. I love to hear what y'all want to see on my channel next. And of course, good luck to you on your nursing journey.